How to lower your high blood pressure during pregnancy. High blood pressure and pregnancy isn't necessarily a dangerous combination. But having hypertension during pregnancy requires special care, irrespective of whether you are diagnosed with this problem before or after conception. High blood pressure, medically known as hypertension, means the force of the blood that pushes against the walls of your arteries is too high. Blood pressure readings of 140/90 mm/Hg is considered too high. During pregnancy, women can suffer from different types of high blood pressure, such as gestational hypertension that develops after 20 weeks of pregnancy, chronic hypertension that was present before pregnancy or that occurs before 20 weeks of pregnancy, chronic hypertension with superimposed preeclampsia that occurs in women with chronic high blood pressure before pregnancy. Preeclampsia, a type of pregnancy complication characterized by high blood pressure and signs of damage to another organ system. High blood pressure during pregnancy puts extra stress on your heart and kidneys, which in turn increase the risk of heart disease, kidney disease and strokes. Along with these, other complications may include fetal growth restriction, preterm delivery, placental abruption and cesarean delivery. When suffering from hypertension during pregnancy, it is important to monitor your blood pressure level closely throughout the pregnancy. Managing your blood pressure can help you have a healthy pregnancy and a healthy baby. At the same time, ultrasound exams should be done frequently to track the growth of the baby in the womb. Here are the top ways to lower your high blood pressure during pregnancy. 1. Monitor your salt intake. Generally, when people with high blood pressure cut back on salt, their blood pressure falls. It even prevents blood pressure from rising. A 2014 study published in Electrolytes and Blood Pressure shows that a reduction of dietary salt intake can decrease the number of deaths from hypertension, cardiovascular disease and strokes. Always remember that the body needs a small amount of sodium to work properly, but excess salt will only increase your blood pressure and your risk for heart disease or a stroke. During pregnancy, you must keep a check on your salt intake to keep your blood pressure under control. Do not add lots of salt to foods when cooking. Use herbs and spices instead to add flavor to your dish. Avoid processed foods, fast food and sports drinks, which are high in sodium even if they don't taste salty. Avoid canned foods as they are often high in sodium. 2. Try controlled breathing. Deep breathing is a popular relaxation technique that helps lower your stress levels and stabilize your blood pressure. A 2005 study published in Hypertension found that slow breathing improves arterial reflex sensitivity and reduces blood pressure. Moreover, every time you take in a deep breath, the well-oxygenated blood gets delivered to each and every cell in the body. This in turn provides energy and makes you feel good overall. 1. Lie down comfortably on your back. 2. Place your hands on your chest and below the rib cage. 3. Slowly inhale through your nose so that you feel your stomach move up. 4. Slowly exhale through your mouth by counting to 5, while keeping the abdominal muscles tight. 5. Repeat 10 times and keep your breathing regular and slow. 6. Practice deep breathing for 10 minutes, 2 or 3 times a day, to manage your blood pressure and keep your heart healthy. 3. Enjoy walking. Inactive women are at a higher risk of hypertension during pregnancy than those who exercise. Walking is one of the best cardiovascular exercises for pregnant women. Hypertensive pregnant women can lower their blood pressure by enjoying a brisk walk of 30 to 45 minutes on a daily basis. It is a safe activity to continue throughout all 9 months of the pregnancy. Also, it is one of the best ways to start exercising if you were fairly inactive before getting pregnant. Start with a slow walk and gradually increase your pace as well as the duration, from 20 to 60 minutes. As an added bonus, regular walking ensures you are strong and have lots of endurance when it is time for delivery. 4. Increase your potassium intake. Potassium is an important mineral during pregnancy. It helps maintain your fluid and electrolyte balance. It also aids in the transmission of nerve impulses, contraction of your muscles and the release of energy from carbohydrates, fat and protein. An adequate amount of potassium also helps keep your blood pressure under control during pregnancy. In fact, potassium-rich foods should be a part of a hypertension management diet, whether you are pregnant or not. A pregnant woman should aim for 2,000 to 4,000 milligrams of potassium a day. Some of the best potassium-rich foods are sweet potatoes, tomatoes, orange juice, potatoes, bananas, kidney beans, peas, cantaloupe, honeydew melon and dried fruits like prunes and raisins. 5. Eat magnesium-rich foods. A diet low in magnesium may lead to high blood pressure. A 1999 study published in Hypertension reports that magnesium deficiency is linked to an elevation of blood pressure. Another study published in 2011 in the Journal of the Indian Medical Association found that patients with gestational hypertension had significantly low mean magnesium levels. This is why you should include magnesium-rich foods in your diet during pregnancy. Along with lowering your blood pressure, this mineral will help prevent the uterus from contracting prematurely. It also helps build strong teeth and bones in your baby. The best way to get your daily dose of magnesium is through a healthy diet. You can get magnesium from foods like almonds, avocados, bananas, beans, pumpkin seeds, tofu, soy milk, cashews, potatoes, with the skin, yogurt, blackstrap molasses, whole grains and green leafy vegetables. 6. Practice prenatal yoga. Prenatal yoga is one of the best ways to keep your stress level under control. Stress can cause elevated blood pressure, regardless of whether you are pregnant. At the same time, stress during pregnancy has been linked to premature birth, low birth weight, and increased developmental and behavioral problems in the child. Prenatal yoga is a multifaceted approach to exercise that encourages stretching, mental centering and focused breathing. Apart from reducing stress, it can improve sleep, increase the strength, flexibility and endurance of muscles needed for childbirth, and reduce lower back pain. A 2014 study published in Depression and Anxiety shows that yoga can help keep expectant mothers stress-free. Women who attended a yoga class each week for 8 weeks had decreased anxiety scores as compared to the control group who received normal antenatal treatment. 7. Monitor your weight. Some amount of weight gain during pregnancy is normal, but if your weight gain is excessive, take it as a warning sign. In fact, weight gain in early pregnancy may be a potential target for interventions aimed at reducing the risk of hypertension. At the same time, being overweight also increases the risk of other health conditions during pregnancy, such as backaches, exhaustion, leg cramps, hemorrhoids, gestational diabetes, heartburn and aching joints. Through a healthy diet and a proper exercise routine, you can get to a healthy weight. Talk to your doctor about the weight that's right for you and follow the instructions given by your doctor. 8. Listen to music. Listening to the right type of music for at least 30 minutes, 2 or 3 times a day, can lower your blood pressure. As an added bonus, music can help you deal with stress and anxiety, which can make things more complicated during pregnancy. Stress is also not good for your unborn baby. Slow tempo and low pitch music, without lyrics or loud instrumentation, can calm people down, even during highly stressful times. Listening to soft and soothing music during pregnancy also helps create a wonderful bonding experience for you and your baby. Plus, it enhances the stimulation of your unborn baby's growing brain, and improves sleeping patterns for newborn baby. Additional tips: get early in your regular prenatal medical care. If your doctor says you need medicine to keep your blood pressure under control, be sure to take it every day as prescribed. Those who are at higher risk for preeclampsia may have to take low-dose aspirin to help prevent it. This will be advised by your doctor. Don't stop taking any medicine without talking to your doctor. Smoking and drinking put stress on your heart and cardiovascular system. It is also dangerous to your baby's health. Say no to smoking and drinking while you are pregnant. Avoid caffeine during pregnancy, as it has been linked to reduced placental blood flow and a risk of miscarriage.